Adopted by 179 governments, including Sri Lanka, the ICPD Program of Action established a visionary framework.
The significant change in that was there was a paradigm shift from family planning to reproductive health. So this was for the first time was implemented by governments during the successive periods, because this was a 30-year period. So every 10 years or every 5 years this was reviewed. So the first program, Sri Lanka, was represented by Mr. Bradman Veerakon and myself, and subsequently as a result we formulated a population and reproductive health policy for Sri Lanka in the next 10 years.
At its core, it urged the empowerment of women as both a fundamental right and a key to improving the well-being of society as a whole. UNFPA played a significant role in the planning and implementation of the conference, and since then, it has been instrumental in advancing the goals and objectives outlined through its mandate. From Cairo to Nairobi, Sri Lanka has been present at key milestones, bringing key initiatives to the forefront of population development in the country. Formulating the population and reproductive health policy, advocacy strategy for population and reproductive health, a holistic reproductive health service delivery program, establishing well women clinics, enhancement of public infrastructure. Taking these initiatives forward, Sri Lanka has made significant progress in ICPD targets. Population change decreased from 1.0% in 1994 to 0.3% in 2023. The prevalence of underweight children has significantly reduced. Downward trend in infant mortality rate. Significant decrease in maternal mortality. More children have access to quality primary education. Reduction in adolescent fertility rates. Nearly all births are attended by a skilled professional. Greater access to modern contraceptives. Elimination of mother-to-child transmission of HIV and syphilis. This progress is achieved through strong partnerships with government, development partners and key population groups. At the ICPD 25 Summit in Nairobi in 2019 and the 7th Asia-Pacific Population Conference in 2023, the government of Sri Lanka reaffirmed its commitment to achieving ambitious goals as we approach the 30th anniversary of the ICPD. Reducing maternal mortality ratio by 2030, strengthening the family planning program, integrating population dynamics into development policies and climate action for sustainable development, promoting gender equality, empowering youth, strengthening South-to-South and triangular cooperation.
Sri Lanka's progress toward the ICPD targets is commendable, with significant shift in population dynamic, reduced infant and maternal mortality, and other health indicators. Commitment to primary education, lower adolescent fertility rates, and increased access to modern contraception underscores success in reproductive health and rights.
While progress has been made, we need to work together to achieve gender equality, as reflected in Sri Lanka's position in the Global Gender Gap Index.
It is a supply-oriented program where we have to meet the needs of the people, meet the needs of population and reproductive health of the people. So in that context, I think the international community has an important role to play to support both the government and NGOs to implement the reproductive health needs of the people.
We cannot ignore the emerging challenges posed by climate change, population aging, low fertility, and migration. In the wake of the COVID-19 pandemic and a multidimensional crisis, Sri Lanka has faced unprecedented challenges. Now, more than ever, renewed efforts are required to accelerate progress toward achieving the objectives outlined in the ICPD Program of Action. To achieve this, we must harness the potential of women and youth, empowering them to actively participate in the country's development journey.
Throughout the ICPD and UNFPA's 5 decades of dedication to Sri Lanka, one commitment remains: empowering individuals, especially women and girls, remain and focus. For the past 30 years, the ICPD has been a beacon of hope, championing reproductive rights, gender equality, and sustainable development. UNFPA Sri Lanka's enduring 50-year commitment reinforces these principles, paving the way for progress.
UNFPA's commitment to the core principles outlined in the ICPD Program of Action emphasizes the importance of ensuring gender equality and women's empowerment. Universal access to sexual and reproductive health services, including maternal care and adolescent reproductive health. Join us as we continue to uphold the vision of the ICPD Program of Action, ensuring a world where every individual's rights, needs, and aspirations are respected and fulfilled.